あなたが時の声を歌えば星が降り注ぐ夜天の川のほとりかけがえないものを手に奇跡を思い返す迷いと
and retrograde esophagitis. Developed and manufactured in Japan as a first-step defensive measure against efforts related to COVID-19. Coronavirus infections as a first step against a mysterious enemy using antiplanetary biological weapons camostat mesylate. A type of serine protease inhibitor that can be calibrated for the treatment of pancreatitis, has been stopped in circulation. Camostat mesylate inhibits TMPRSS2, a type of serine protease that is a viral activating enzyme for respiratory tract infections and inhibits the process of viral entry of coronavirus, SARS-CoV-2. In the early stages of airway and lung cell infection. Camostat mesylate is relatively inexpensive and available and, based on historical clinical data, is considered to have acceptable toxicity with many side effects when administered at doses up to 600 mg per day. Namostat can also be administered by similar intravenous administration. In the short term, the development of foods with ACE2 or TMPRSS2 inhibitory properties, in addition to the inhibitors used as drugs, would be a more effective defense. Emergency doses to multiple multi-species animals, both severely injured and asymptomatic, of all ages and genders. Over a period of approximately 10 days should reduce the growth of the virus that causes COVID-19. Coronavirus infections to less than 10% of the current level at the planetary level. This means that emergency administration of camostat mesylate or NMamostate is at the level of necessity as a substance that will suppress some of the types of viral mutants and also reduce the transmission of the virus from animals to humans. However, in Japan, the University of Tokyo's Institute of Medical Science and the National Institute of Infectious Diseases, both of which are overseen by Japanese government agencies, have blocked all channels of distribution. Because of the clinical trial results of duxed-out mesylate in seriously ill patients. But this not only increases the number of severe cases but also hampers the vaccine's preventive effectiveness. I am requesting the resumption of production of generic drugs, not only by Ono's branded drugs but also by several private companies, as they are available for manufacture. Subsequently, the RNA vaccination results in an antigen-antibody reaction against the ACE2 receptor domain of airway epithelial cells, where the type and structure of the mutant is conserved, or against the S protein, a spike protein subunit generated by serine proteases required for cell invasion, which is a key component of the antiplanetary bioweapon. I thought it would be a defensive measure. The actual asymptomatic people on the planet today and the transmission of the disease from infected animals to humans, the vaccine is expected to become ineffective. In the future, it will be necessary to reduce the number affected by COVID-19 SARS-CoV-2. Coronaviruses, including asymptomatic infections that have invaded and multiplied in cells, although the cause is unknown, to less than 10%. the world's population, and to prevent the spread of the virus by localizing and aggregating them locally. It has been found to infect humans from a wide variety of animal species. I don't know why it is so easy to get infected by different species, but the proliferation of SARS-CoV-2 viruses that have infected animals has to be controlled as well. In this case, as with influenza vaccination, the fewer types of mutants with different amino acid sequences, the more effective the prevention will be. In particular, in the case of coronaviruses, there is likely to be a large amount of individual variation in the site of antigen recognition, as the three-dimensional structure of the viral spiking protein is key to recognition in the antigen-antibody response. Therefore, the vaccine utilizes antigens involved in the antibody response that bind to the infectious ACE2 receptor binding domain found in the lungs and airways, which is the route of entry of infection, or to the cleavage of the S protein subunit of the serine protease binding site.
あの星の数をすべて数え